Hi, Dr. Craig Yager with the Colorado Springs Orthopaedic Group, back to discuss my doctor's notes regarding clavicle fractures. So treatment for this type of injury often depends on exactly where the clavicle has been fractured and how much displacement has occurred at the fracture site. Displacement is just how far apart the bones are. If they're too far apart to heal on their own, oftentimes surgery may be recommended. Surgery for this can be as simple as fixing the fracture with a plate and screws to hold it together and allow the bone to heal on its own, or may require reconstructing or rebuilding some ligaments within the underside of the collarbone as well. Typically, at the day of your appointment, we would take an x-ray and review that x-ray together to talk about how much displacement's there at your fracture site, and will often tell us everything we need to know to determine the optimal treatment outcome to allow your bone to heal and allow you to get back to doing what you love doing. Typically, clavicle fractures are best seen and evaluated and taken care of as soon as possible right after the injury. If it's been a long time since your injury, there may already be some healing present, which may limit our options for taking care of it. And it can be difficult to put the bone back in place, which may require re-breaking the bone to get its alignment back to a better position. The good news about clavicle fractures is that the majority of them can heal successfully without surgery. Most people do well regardless of their age. If surgery is required, about 6 to 8 weeks for the bone to heal, and your motion and strength should return shortly after that. Often people are back to their normal activities within 3 months of their initial injury. If non-operative treatment is used, it's typically a similar timeline before you're returning back to your typical activities. If you're still having pain in your shoulder or having pain over your clavicle, it's always a good idea to make an appointment to see one of us, to have a quick x-ray, to make sure that nothing's gone wrong. Our phone number is 719-632-7669, or you can visit us at our website at www.csog.net.